There we go.
All right, everyone. Thank you for being here today at April session of the World IO Forum. Today, as the screen says, we are focused on IO and healthcare. I'm going to explain a little bit about how each of these sessions goes before we launch in and get to speak to our panelists today. So our next session, which Rigo will add to the in the comments in a moment for anyone interested, is going to be the same format as this with panelists and will be focused on IO and AI. It as an industry is growing, it's impacting everyone else's industries, so we'll be focused on what additional opportunities, roles, everything exists right now for IOs within that specific context. So mark the date, join if you'd like, but today we are here to talk about healthcare. If everyone would give a quick virtual round of applause with whatever emojis they'd want for our panelists, I wanted to thank all of you, Karen, Lewis, Arthur, and Ryan, for being here today to share your various experiences in healthcare. Both Karen and Lewis are from the United Kingdom, whereas Arthur and Ryan are both from the States. That said, there's a whole lot more unique qualities about each of them. I'm going to bring them to the front to introduce themselves in just a moment. But just to provide a little more context, we're going to have about 30 minutes of panel session where each of our panelists are going to be able to interact and speak with each other and answer a variety of questions in a guided conversation. Following that for about 30 minutes, we're going to have roughly 15, 20 minutes for the audience to ask questions as well. So as you hear the conversations and ideas pop in your mind, write them down. You are more than welcome to share them. Otherwise, I will fill that time by having my own questions. And then at the very end, we always save the last 10 minutes to share resources. These are just going to be additional IO events that you can be attending for free, local networks, and any additional opportunities that our panelists might want to share to make sure that you know everything there is to know about their specific area. Now that we've done that housekeeping, I think you are here to hear the panelists. So let's hear from the panelists. I'll go ahead and ask each by name to give a quick introduction, and then we'll launch into the panel itself. And Karen, would you like to introduce yourself since your name is written first?
Thank you so much and welcome everyone. As D'Artagnan said, I am in the UK. I live in England. I am a CQC registered manager. So in the UK, our regulatory body is CQC, and they are inspectorates that just make sure we're running everything safely and doing everything that we're supposed to be doing. So I run services all across England, um, working with people with complex physical, mental health, and addiction difficulties as well. I've worked across health and social care for nearly 20 years. Um, it's interesting how IO, or in the UK, says organizational or business psychology integrates into services. So I'm really keen to get everyone's experiences and discuss them.
Wonderful. Thank you, Karen. And Lewis, would you like to go next?
Yeah, of course. Hey, folks. So my name's Lewis Burton. Lovely to
Hmm.
be here. So a bit like Karen, I live in England. Um, so I am the head of leadership, learning, and organisational development at a mental health trust. So I'm one of the trusts that Karen within the CQC will come and inspect and rate. I've been an organisational psychologist for approximately, crikey, seven years now. I've worked in healthcare for about five. And before that, I worked in the food industry, managing restaurants and setting up social enterprises where we took individuals who had just come out of prison and taught them how to run their own food business. So yeah, I work in like I said, a mental health trust, and there's about 5,500 employees, and that basically serves a huge population across two counties. I think of over 400,000 people. So yeah, that's me.
Awesome. Thank you, Lewis. Arthur, batter up.
All right. Well, hello, everyone. My name is Arthur Theodore, and I am located in Sunnyside, Florida. I got my master's degree in IO psychology back in 2019, so I still consider myself relatively new to the IO space. Currently in my role, I'm working as an organizational readiness analyst, and really that's just a fancy way of saying that I work within my organization, which is a huge healthcare organization with about, I think, hospitals and medical facilities in 7 different states in the US. But in my role, I work in an ancillary role, which means I don't work directly with patients or even providers. What we do is the work we do helps to provide them with the right work environment, ensuring that they have all the different benefits and essentially all the tools and facilities that they need to be able to provide that care to the patients. So happy to be here and happy to be able to share this space with the other panelists.
Awesome. Thank you, Arthur. And last and not least, Ryan, will you bring us home?
Yeah, thanks for having me. So I'm Ryan Olson. I'm a professor, an occupational health psychologist at an occupational health center in the School of Medicine at the University of Utah. So rather than being in a psychology department, I'm in an interdisciplinary center that includes occupational environmental medicine physicians and occupational health nurses, industrial hygienists, and engineers, ergonomists. So I spent most of my career developing and studying in randomized trials, workplace injury prevention and health promotion interventions. But I spent one line of my research is focused on home care providers who are sort of in an in-between space adjacent to healthcare. So the people I've focused on provide in-home services for people who qualify for publicly funded in-home services, so paid for by Medicare or Medicaid. So my work has focused on uh, trying to prevent the workers from progressing to work-related disability and help them live well, but also the people they care for. The whole service and the health home care system keeps people out of inpatient treatment programs or long-term care facilities. So I can talk about working in a program that trains multidisciplinary folks who many of them end up working in healthcare, and then this space of workplace health promotion and workplace health promotion in particular adjacent to the healthcare system.
Okay. Thank you, Ryan. And I'm going to begin to take a little bit of a back seat now as the host, letting our panelists lead the conversation. And I'm going to throw out the question of like, people hear about IO in healthcare and the pit. It really is the first image that appears for many. This high stress situation where there's an emergency room and people are dying left and right, and what are you going to do is so often thought of as healthcare. You've each shared a little bit of your area, but I'd really love to hear more of like correcting the image. Give us an idea of what does the day-to-day look like that's not sawing off legs or whatever media may have told us about healthcare. I'd love to hear some comparing, some contrasts between what each of your experiences looks like on the day-to-day. And I'm going to stop sharing my screen now as you continue to speak.
I think I'd like to
with
start by saying I don't know what the pit is.
okay. So it's a new series that's playing, I want to say, on HBO Max in the States. And really it shows, I want to say it's not the ER. Actually, I think it is the ER. So basically it shows this ER unit and basically the chaos of what a whole 12, more so 14-hour shift can look like in an ER setting. And just all the different kind of people that come through, how quickly they have to think on their feet, the different kind of patients and the different type of individuals that you have to interact with, and of course how they have to deal with the nuances of the bureaucracy of their healthcare system as well. Very good show.
Okay.
Definitely recommend it.
I think I might have to get that on my watch list. Definitely for me, I've worked in ER, I've worked in hospitals. Ryan, I really I understand. I work in community. My current service is community, avoiding hospitalization and things like that. So there's definitely a different level of, like you said, the word there, bureaucracy, but also how we implement IO or business psychology into our services and things that we do. It's vastly different depending on the type of service that you're in, isn't it?
Absolutely.
And I'll add that, most healthcare organizations well, at least my experience in the States is they're quite large, and so they're big organizations, and they have a human resources department, and the HR department's involved with recruiting, hiring, onboarding, all these things that IO psychologists deal with, and then management of employee health and well-being and training. Um, and so there's a place for IO psychologists in the operation of the healthcare system. And then, in addition to the emergency operations, if you've been to the doctor yourself and noticed what's happening in the clinic, there's electronic IT systems, there's people at the front desk who are managing your check-in, and then there are medical assistants who work with the physicians who eventually come to see you. And so all those types of clinics vary too by specialty. So, and each specialty has their own pain points and pressures. And so, as an IO psychologist, I think there are lots of places where our expertise is relevant, especially if you just start looking under the hood of a healthcare organization as an organizational system, helping people get their jobs done.
Yeah, definitely getting their jobs done and doing it while keeping themselves well. I think that's another part, isn't it? Particularly in
Mm.
IO, high pressure, high stress roles, quick decision making, and it's a decision that could ultimately affect somebody's life, and that's a lot of pressure for people to be under.
Yeah, definitely, Karen. And I guess, yeah, in my role, a bit like yourself, I've worked in acute hospitals, and there are, depending on what work you're doing, you need to go understand what is going on for the day to day for individuals. So I've spent time in theatre, I've spent time in emergency departments, I spend time on wards at the moment in my mental health trust. But a bit like was being said, IO kind of goes across all manner of different spheres. Essentially, I guess I sit in the people and culture directorate over here, and I oversee leadership development, learning, and organization development. But I spend a lot of my time working with senior leaders, so working at that strategic level to really influence how they structure work, how they design work, how we use systems, how we build, I guess, cultures and leadership practices across their services as well. So it's a real mix. And then sometimes I will just have days where I am just presenting lots of different papers because, yes, we have huge governance structures, as they call it, with how work gets decided. And I think that, to me, is probably one of the biggest shocks that I've had coming into healthcare, is how work gets done, which is something that you have to be very prepared for as an organizational psychologist, because on the one hand, you have the most up-to-date view on actually how an organization should function. And when you come into that rather large beast that is the NHS, as we call it here in the UK, it's quite a shock with what is seen as inefficiencies of working practices. But actually, it's just a system serving itself. So yeah, that's some of my reflections.
So
I'm
I'll
glad
say
you've
for
mentioned
me,
there about the bureaucracy, the paperwork and things, and it's a lot, isn't it?
so I'll say for me, my role really does look a lot like what Lewis was explaining earlier, where again, I don't necessarily get the opportunity to work with providers, but we do work with their overall leaders. And our job really is to ensure that the leaders understand how they can best support their providers. And so I think one of the examples I can kind of share in terms of what the day-to-day look like is recently we rolled out a new enterprise resource planning system. So essentially, when you think of how people get paid, where they have to go to figure out their benefits, if they need to apply for, a specific type of service, where do they go for that specific service? So for us, our job is to help roll that out and make it as seamless as possible. And especially when it comes to training providers specifically, they don't have a lot of time. Their job is to really be patient-facing as much as possible. So then how do we provide them with the right type of training method so that they can get the training they need, and then move on and get back to work? And so for me, my day-to-day really is working with their leaders to understand what's the best way to, develop those type of material for our providers. And I would say in terms of how does that tie into healthcare specifically, For us, it's really about understanding that even though we don't touch patients directly, the work we do still does lead to them having the best care that they can receive. And just always keeping that in our forefront anytime that we are working with leaders to develop, a system and understand how the system needs to be tweaked. They don't need to be signing in 4 different times to get to the service. If they can have a single sign-on, that alone can help them decrease the amount of time that they can, take to get to whatever they're looking for, and then they can get back to work.
I think there's a bit of difference in my role in regards to how I apply IO in my role. So I am manager over all the services. So I am predominantly I am service user facing. So I do a lot of visits across our supported living, our community, our NHS services. I am actually at the forefront of the service users. So I'm the one doing the assessments, determining capacity, liaising with all the professionals, whether it's the mental health team, a clinical team, learning disability team. So I'm very much on the forefront of healthcare. Now, I think when we think of IO, we often think of that behind the scenes, and I think there's a misconception of that. And I think what I can hopefully show is you can still be on the front line and have them skills and then be utilized. I think for me, the biggest skill in my job role that I've learned during my sort of degree in my master's and I'm doing my PhD is the art of negotiation. And that's not just with other professionals and other services, it's actually the art of negotiation with the people we support as well. I think that's definitely a skill that is, something that's really useful.
Well, I want to interject real quick because as someone who does not come from the healthcare industry, I'm following this conversation, but I'm also being reminded of how often I hear a completely different language of words that I'm having to quickly adapt to and figure out, oh, all right, I wish I took a crash course video on hospital or just healthcare language 101 to refresh myself before the conversation. So I'm sort of wondering, like, really, if you were not in healthcare right now and you were having to restart your career in healthcare, knowing what you know, what advice would you have? Like, what would be the first 2 or 3 steps that you think someone who has no background in healthcare whatsoever, this is really what you might want to consider if this is an area you're looking at?
I'll jump in because early in my career, I asked this sort of question of an experienced professor in the business school. We had a sort of supportive program for new faculty, and Andre Delbecq, who's now deceased, but I was asking him. I was wanting to develop a new research program in a new direction, and I was just seeking advice, and his answer was go where the people are that you want to get involved with. So this is find the trade associations, find the conferences where these people get together and show up and just start listening and learning. Learn the vocabulary, learn what their concerns are, hear about their problems, introduce yourself and network. And at the time, I was wanting to do something in the commercial trucking industry, and I just started showing up to those trade associations and built my network from there. So I think similarly for healthcare, that would be my first step is start showing up to their conference professional gatherings and listen and learn the language and their pain points and their problems, and you'll have ideas about how you might be helpful or where you might fit.
Yeah. I don't know if Lewis would agree with me in the UK. For me, what I would suggest is get into the area that do a bit of research onto whether you'd want to go private, NHS, what type of service you're interested in initially. And similar to Ryan there, it's, look at the pain points, look at the areas that intrigue you, interest you. I think also in the UK, we have quite separate services in regards to if somebody has a learning disability or a mental health, they're very separate services. So for me, it'd be looking at the type of niche of individual that you're really interested in supporting.
Yeah, and I think one thing that I'm constantly telling master students when I'm lecturing to them is around understanding that actually one thing we have in the UK is, especially in the healthcare setting and the NHS, is there's not many roles called organizational psychologist. So it's
Yeah.
about really exploring around, a bit like Ryan was saying earlier, understanding all the different elements that we're in, and being really open to maybe landing a role as a recruitment officer or something like that, rather than just looking for those pure organizational psychology roles. I think following on from what you were both saying as well is really one thing that I learned was really useful when I first joined the healthcare setting was going out and seeing the services, like smelling, seeing, feeling what is going on. Because a bit like the pit does, you actually start having the same reaction of what staff are having, and that really grounds you and enables you to actually hold that while you're doing the work and go, this isn't going to go the way I know it's going to go because this is what these people are dealing with. And I think that's probably the most important part to me, is taking that like purest view of organizational psychology and being able to translate it into a very stressful, pressured, under-resourced environment that we have in the UK, because it is public, rather than maybe the kind of private structure that you have in the US. So that would be some of my thoughts.
Something else for students, especially or recent grads, is you're in a special window where there are internships available to you that are not necessarily available to others who are maybe making a switch mid-career as easily. So if you could find an internship, paid or unpaid, in a healthcare organization, that's a great foot in the door. We currently have one of our occupational health psychology students who's doing his summer internship at the Salt Lake City Veterans Administration Hospital in the Environmental Safety and Health Department. So internships are another great opportunity. And I'll second Lewis's note there on job shadowing. It's invaluable to get to know the work by just seeing if you can be a fly on the wall, but that requires you to be in the organization in some role as an official visitor, intern, or new employee most of the time.
So I feel like for me, the advice can probably be applied to any industry, but in terms of healthcare specifically, one of the things that I want to touch on is what Lewis kind of hinted at. In the States, we do have healthcare organizations that are for profit and not for profit. And so I would say for people looking for jobs, sometimes that may be something you want to look into to see what type of healthcare organization you're looking to interact with. And the differences can be stark in terms of what they want to do in terms of implementing an IO and what you're actually looking to, help within that organization. And more so, I would say when you're looking at the different job descriptions, a lot of times organizations kind of give you an idea of what their culture is within that description. So reading it and understanding, do I feel like I would match what they're looking for in terms of the individual? And then, of course, make sure that you meet at least some of those skills that they list. And I know our panelists have kind of touched on it already. A lot of times we look for jobs that mention IO, even in the degrees. I almost never look for jobs now that have IO psychology in the degree. If they say something like, business or other relevant, I'm like, okay, I'm the other relevant. The skills you're asking for are things that I learned in my graduate programs or things that I've taken upon myself to continue learning on my own free time. So I'm going to apply to this position and then help to advocate for myself, when I go through that first phone screening or in later rounds. So that'd probably be my advice for people on the line in terms of how to break into the healthcare organization. One, have an understanding for what their mission and purpose is as a health organization. And then two, just really try to understand how you can leverage your skills and abilities that you've developed either through, coursework or through internships, etc., so that when it does come time to have to explain your degree and how you match the description of what they're looking for, you can help to showcase that.
So I want to address a myth real quick, or a story at least. It's often an assumption for those who have not worked within healthcare that, like, I don't know, if you didn't study healthcare in high school and then do healthcare as a major in undergrad, and now you have a advanced certificate in healthcare, that there's probably not a place for you. I assume that's incorrect, and I hope we've kind of fought against that myth. But is there any other comments or discussion to be had about what it's like, or if it can happen, of going ahead and getting a degree, whether it's IO or even anything else, not having a healthcare background, and yet going ahead and saying, this is what I want. Let me actually make this transition. Is that a realistic opportunity for most people who are in this room and might be considering that?
So I would say most definitely our field is really multi-industry, multi-occupational. So that's both a plus, but also a challenge. So it's your job as an IO psychologist to specialize in what you want to do, because you could apply the knowledge in any industry, but in order to develop a track record in an industry, you've got to get your foot in the door and start, developing yourself to have that industry specific expertise. And so in my experience, most IO psychologists, occupational health psychologists end up specializing in a particular niche because you kind of need to. You can be a generalist, but why not healthcare, or oil and gas or green energy, wherever you want to work, you can if you put your mind to it, I think. So it can be stressful that our degree is that flexible, but it's also a plus that you can find a place in healthcare if you're interested.
I 100% agree with Ryan. For me, I actually didn't have a background in healthcare whatsoever. So I started off actually supporting the federal government when I first graduated. And so from there, I pivoted into healthcare. And the way that I pivoted was really trying to describe some of the work I did when I was supporting our veteran affairs and how that could translate to a healthcare environment. On top of, again, just being able to show the different skills and experiences I had in my past experience and how that translated to the specific role that I was applying for. But I agree 100% where, yes, it can be very difficult to break in, mainly because within those job descriptions, they typically say, hey, we would prefer someone that has healthcare experience. But again, that's where you try to hit on everything else if you can. And then once you can get that first phone screening, once you can beat, at least in the States, when you can beat the applicant tracking system to then get that phone screening, typically then you can start to advocate for yourself in terms of, hey, here's why I think I'd be a great fit for this role and for your healthcare organization as a whole.
Yeah, I think it's very similar in the UK. I think the only with the NHS, there is a certain language that people use, and for instance, when you're looking at job descriptions, there will be things like, previous NHS experience. But again, it's about within your application really showing, how you can apply all the skills you've got into that healthcare setting. And I think we're getting better as an organization to really get rid of some of that bias that's creeping into job descriptions and job adverts and things like that. So I always kind of tell my students as well, don't just ignore half of a job advert, in my opinion, or a job description, because it's kind of there's loads of bias in it, and actually you don't need to tick all the boxes. Because I would say in the NHS, in the UK, they don't quite understand the impact organizational psychology can have, and often it's kind of really misrepresented. But it also gives you an opportunity to really flourish in that environment. So yeah, it's kind of one of those ones where actually I think there is an almost barrier sometimes, but I think that you can easily get through it by kind of like Arthur and Ryan were just saying, around how you actually translate all of your amazing knowledge that you've got into all those various different areas that run across all the different functions that healthcare settings will have.
I kind of wonder if we shouldn't also throw out volunteering. If you really have no foot in the door with healthcare, so much of the system includes and integrates volunteers, and just volunteering for a few hours a week or even a month might be just a little bit of that first line on your resume of some exposure to a healthcare system. But sorry, I think Karen was about to say something.
That's okay. I think that's a really, really valid point, Ryan. And I think it's often underestimated, isn't it, the power of volunteer work? And I think that links in with what was mentioned earlier about actually having on the ground experience that will help sort of solidify that this is the area that I want to get into. And I think it's important to mention, you know, we talk about work and being paid for work, but actually volunteering gives us a lot of experience that will help us get our foot in the door. I started my career in healthcare while I was doing my degree in psychology, and I was actually a carer. I travelled around my local area, supporting people with mental health in the community. So that's how I kind of got my foot in the door. I didn't actually become a business psychologist until 4 years ago. And during my career, I've kind of stepped up the ladder. I went from carer to senior to housing, into a little bit of everything, went into the NHS for a little period of time. Now I'm in a social care, a private social care organisation. So I climbed the ladder, and it wasn't until I actually got to this registered manager position that I thought, actually, a lot of what I'm doing is business related. It is contract negotiation. It is looking at recruitment. It is, you know, our health and safety executive and the health and safety things that we've got in place. So I made the decision 4 years ago to do my master's in business psychology. And it was purely from my experience that actually led me to that academic route. Carrying on with my PhD now, it's only been the last couple of years that I would say I found my niche, which is definitely in the addiction field. But it's taken me a long time to actually find that specific niche where I'm like, this is where my heart is. This is what I genuinely love to do. And I think it's acknowledging that we have to experience different things sometimes to actually recognize what particular area we want to get into.
And thank you for that, Karen. I'm gonna switch our style a little bit because I've gotten to ask y'all all of my questions, and it's been so nice getting to hear the responses. But I'm aware other people have questions as well. So if you'd like to ask any questions of the panelists, feel free to raise your hand, and Rigo will say go ahead. Put your questions in the comments, however you'd like to share them. Go ahead, and we'll start to answer those until about the 50-minute mark.
I have a question for Arthur, and this may be applicable to anybody else in the meantime while other people prepare their questions. You mentioned something about having a single sign-on method that helps with sort of that process for them, and actually work in HR information systems, and that's like one of the areas that we look at optimizing is how do we process and work with the systems. It kind of touches on the area that Ryan also mentioned, the ergonomics interacting with human systems, information systems, technology, where it all intersects. My question is, how does that work in a healthcare setting? Are there specific roles delegated to doing that type of work, or are there more general roles that get to touch on those kinds of areas?
Okay, I want to say I heard the bulk of your question, Rigo. So in terms of how we interact with, single sign-on, I'm not the one that is in charge of, or I should say the team that I work on isn't in charge of creating that system, but what we are in charge of is working with the leaders to understand how that process would either benefit or hinder, the providers who are going to be the ones that are going to have to use that system. And then we also work with IT, who are the ones that are typically more concerned with security, to understand, hey, is this something that will actually ensure that we continue to protect, the information that needs to be protected, or does this, make them more susceptible to being hacked? And if so, then we're not going to go for it. So we help to facilitate those conversations, I would say, as IOs, having an understanding first of the process, but also of people in general, in terms of all the different classes that you might have taken in undergraduate that can still serve you in terms of how can you be that negotiator. I think it was Karen that mentioned that. How can you be that negotiator to help both sides understand what the pros and cons are, and ultimately what's the case to be made that will ultimately help, the providers, which will then help the patients. Because again, our job in our minds at least, is to reduce as much time as possible for the providers to be able to use whatever service that they need to use so that they can get back to helping the patients. I don't know if that helped to perfectly answer your question, but if there's any other things that you'd
No,
like clarified,
that
let me know.
pairs, yeah, that pairs process optimization and efficiency with the information systems, and then also what Karen mentioned, negotiation skills. Really cool. Thank you.
Yeah, absolutely.
Did anybody else want to add to that? We do have a question in the chat as well. All right,
Audrey,
I'll
I
read
saw
this
your
one
hand
off.
was raised.
Yes, my hand was raised. I did have a question, but first, thank you guys so much for discussing more on the topic of healthcare, especially where IOs fit into that. And just for some context, I am an early career professional in IO psychology. I've worked across a variety of different industries, one actually being healthcare as an external consultant, and it was for a nonprofit. And I really enjoyed that work, hence why I'm here hoping to learn more, which I have. And so there we were working with analyzing the vicarious trauma that the employees were experiencing from their patients. So it was really, really cool to be able to do meaningful work. And that's kind of where I'm hoping to explore that niche. And as Karen was discussing, like it takes a lot of time to find that. And I think I've identified that. However, my question, based on my situation, which is a little bit unconventional, I actually recently graduated and moved from Raleigh, North Carolina to Paris, France. So I'm in a completely different job market where it has been a challenge, to say the least, to navigate the different cultural differences with how the world approaches IO psychology in the context of France, because they assume that we're clinical psychologists, and that's not necessarily the case. So my question to you guys is, with that in mind, what strategies have you found the most effective for differentiating yourself, advocating for yourself, and building that credibility as an IO professional in those European job markets where the field really isn't as recognized? Oh, sorry.
Yeah, well, I think I would definitely connect with the occupational health psychology associations in Europe, because they're going to have the language of how they talk. IO as an American term, it's work psychology or organizational psychology. So those associations might help for just professional networking. So that would be one bit of advice. But I'd also say in the healthcare environment, the assumption that you're a clinical psychologist probably applies here as well, or they don't really know what to do with you as an other form of psychologist. But I will say that physicians do value the kinds of things we learn as IO psychologists. They know behavior is important with patient behavior change, compliance with treatment, and also in management of staff. They know human behavior and management of behavior is tremendously important. So they know it's important, and they love to have the advice and expertise from somebody who knows what they're doing in those areas is valued. And then also survey scale development, employee listening surveys. Physicians are not trained in psychometrics or survey development, and they don't get much statistics. And so a person with an IO background with that kind of expertise is valued as well. So maybe Karen and Lewis, being in Europe, might have much better additional advice, but I did have those few thoughts, so I thought I'd share them.
Thank you so much.
Yeah, it's I'd second that. So yeah, definitely looking at kind of the kind of psychology IO field out there and seeing who you can get in contact with. But in terms of my role, I do a lot of work with teams, a lot of like team coaching and a lot of exploring kind of cultures and issues. And often, yeah, I will get, people will be like, oh, you're a psychologist, so you can come and help with this. And I have to be very clear that, I'm not clinically trained, but also, my kind of expertise is around kind of, team behaviors and working with that. And I think that's something that they really, really value, especially as Ryan was saying, clinicians definitely value that. So I work alongside, clinical psychologists, psychiatrists, directors of psychology. And it's something that, in healthcare, I think they're craving for in a way, but you have to be very boundaried and very specific about actually you work at a system level as well. We want to be doing interventions that are actually influencing everyone, but then at the same time, working with teams and influencing senior leaders and working through some of the problems they have is really important. So I think it's being very clear that you're actually got some expertise in that field. And a bit like Ryan was saying, the kind of staff survey, listening channels, employee experience, employee engagement, again, you've got those expertise, and it's something that healthcare, I think, across Europe is looking at. And I think from my experience, there's certain areas of Europe that are far more ahead in terms of organizational psychology and the view on that, such as kind of the Netherlands, Germany. I'm not entirely sure about France, but that would kind of be my suggestion.
Thank you.
Real quick, we're going to try something we haven't done before, because I recognize that Imani and Ashley both have their hands raised. Ishika and Liam, and I'm missing anyone else? No. Okay, we have 4 questions right now, and we are about to transition to sharing resources, because I want us to try being done on the hour, as I promised. So we're going to try speed round we have 4 questions, 4 panelists. You don't have to divide them up, but we're going to see if we can answer each of these before we share a whole bunch of resources. Starting with Amani. 3, 2, 1, go.
Okay, just wanted to ask from the US experience. Hi, everyone. From the US experience, because almost every role that I'm trying to kind of like look at, or I have looked at, needs a license, regardless whether it's supposed to be patient's experience within healthcare, behavior roles, regardless of also my experience, because I've been in the healthcare, especially on the mental health field for kind of like 5 years now. But with almost every role that I come across, it still needs you to have at least a license in social work, to be in those kind of like leadership roles that can be directly affecting work employees on the behavioral end. And most of them do, yes, confuse IO psychology certificate, but then when you're in the interview, they circle back to it, and then you kind of like still get that block. So I was just trying to ask, is this whatever you're saying, is it also applying to the US market as well? Because that has really been kind of like a big blockage that I've seen within the 2 years of looking at these roles in the healthcare system. Thank you.
I don't know if I have much to say other than if you really want to do the work that requires a license, you've got to do the training and get the license. But otherwise, you can find ways to work adjacent to that function elsewhere. It across countries it may be more flexible, but yeah, I mean it's a real barrier to certain jobs.
Are there any other comments for this one? And sorry that's not as exciting of an answer as one might hope, Imani.
Yeah, I mean, a quick comment would be, I agree with Ryan's assessment. The best you can hope for is if you can find someone that's willing to sponsor you to get that that certification, whatever it is, that's the route to try and take. But otherwise, unfortunately, it really is one of those barriers to entries that you kind of have to face. Either you take on that cost personally, or if you can have somebody else help to pay that cost, it's always helpful to try and do that as well.
And thank you, especially because Imani, that is a relevant question that many people have in their mind. And so I like that we brought it to the forefront just to make sure there's not a magic silver bullet to get past it without having to go through it. And Ashley, you want to hit us next?
Yes, I want to first thank the panel and everybody on this call for really bringing in relevant questions. I've been really informed. And going into my question, I actually have a health background, right? I have a health background and I started getting a lot of interest in IO psychology. My master's is actually organizational dynamics. So it's a lot more like organizational development, but still very much IO. And I've been finding it hard to get into the organizational development spaces with my public health background. I went into a lot of research and health behavior research, but I've been finding it hard to get work within organizational and IO psychology spaces. I was wondering if with the kind of like the switch, especially with Karen too, I heard that also has a health background. I was wondering if you guys had any tips on like getting into more, or like the tips or like soft skills or just things that I could like focus on when it comes down to making that switch into, because I want to blend the both of them. And how can I switch into IO psychology and organizational development a little bit more?
I don't know what it's like in the US. In the UK, similar to you, my background is on the field with people, and that was sort of I showed interest in our HR, our human resources. Can I do a bit of shadowing with recruitment? Oh, what do you mean you have to have a DBS? Tell me more about DBS, which is our checking for criminal behavior. So naturally having that curiosity, but using that natural curiosity to get in. That might be a little bit sneaky, but that's definitely what I did. And sort of getting them, like you mentioned there about soft skills, but actually getting the terminology and understanding it when somebody's discussing it. So by shadowing and sort of having the opportunity to step in other fields, that's definitely what helped me essentially decide to do my business psychology masters. It wasn't what I set out to do years ago, but it's definitely what led me into that path, is having them opportunities and finding them opportunities in different organizations.
This sounds similar to Ashika's question, actually. To get to the core of it, it was how can someone transition more intentionally into the IO psychology side of work or meaningfully integrate IO principles into a current role, as specifically within a healthcare environment. And it is a different question, but I'm also seeing a whole lot of overlap in you're over here, how do you get over there, basically? And as our panelists continue to talk about that a little bit more, Rigo and I are going to share the links again, as well as put up a visual of some upcoming opportunities involving IO, just so that everyone can be more aware of what other events are going on, what organizations exist. And once we've finished discussing Ashika's question and addressed a little bit more Liam's question about about COVID, then we will wrap up with sharing any additional resources before closing up. So we'll share that. Panelists, please continue discussing. How do you get from here to over here when it involves over here is IO and healthcare?
So I can share a little bit. Oh, go ahead if you want to share.
No, you go, Arthur. Go for it.
Okay, well, I was just going to say switching is tough. As someone who has made that switch, it wasn't something that I was able to do quickly. It took months of refining, months of reaching out to people just to kind of have those soft connections. And in the end, I'm going to speak to Ashley's side, and then I can speak to Lewis's side. Ashley's side, and I know I've kind of hit on this in this meeting already, really trying to understand how you can leverage what you've done in the past for what you're looking to do in the future is probably that first step. And then how you can articulate that well to the first barrier of defense, which is going to be the recruiter, the person who's going to screen you. It is a tedious process, and it doesn't come without its faults. What I would say can help is if there is a decent gap between where you are and where you're trying to get, and you can help to close that gap with any type of when I say self work, any type of volunteer work, any type of self training through like a more affordable platform, Udemy, Coursera, things like that of that nature, that would be my advice. And that's actually what I ended up doing, where I took courses on data camp at the time to help me close some of the gap of what I was seeing in those job descriptions for the position I wanted to get into. Now, to Lewis's side, really quickly, I would just say if you're already in an organization and they are invested in your growth and in your ability to continue to stay with them long term, definitely express those interests with them if you feel like you can do so, and let them know, hey, here are the skills that I'm looking to develop long term. How can I help to do that either in my current role, or how can I start to prepare myself for that future role that I'm looking for? And I don't want to take up more time. So if there's other thoughts from the panelists, would love to hear their side as well.
Yeah, it's a really good point. And I think sometimes you do have to go and explore other roles basically that aren't ideal and explore other sectors. I worked in local government for a little bit, and then kind of got a couple of years of experience and used that then to move into another role. I think it's also about how you define yourself, and understanding the organization, whether it be healthcare or others, around like the language they use and what is going to be relevant to them. Because when we look at kind of organizational psychology or organization development, there's kind of language that we use and things that we say that aren't going to translate necessarily to the people on the other end that we're applying for jobs. So I would, I'd love to kind of, when I'm trying to explain what organization development, for instance, is, I have to think of other ways of actually explaining it and making it more simplistic, so it lands better. And I'm always thinking like, what does the business need? What does the organization need? So I can translate that into how I'm coming across. But I would say that, yeah, sometimes you've got to, find a door in there that maybe might not be a role that is specifically what you want to do, but maybe is in the department, such as human resources or people and culture, whatever it's called, and then really kind of embed and show your approach while you're in that role to then move to another one.
If anyone real quick would like to take a screenshot of what we are sharing at the moment, these are upcoming opportunities, events, etc., that exist within the IO space that can be helpful. All of this that we're doing is with psychologyaatwork.blog, and every one of these videos gets recorded and uploaded to the YouTube channel so that in the future, you can go ahead and see, oh, there's AI, there's this, there's organizational culture, there's plenty of different areas, and there's been years of these videos that can be a reference. Coming up, some of you may be aware, is the annual PsyOp conference. Fun fact, there's a thing called PsyPub that will be happening the day before. If you're already in New Orleans and want to go to PsyPub, it's free. You are more than welcome to come. And the PsyOp conference is the 28th to the 2nd. That's an in-person conference. To talk about stuff that's more accessible to the rest of the world and not just those who will be in New Orleans next week. Our next session like this of the World IO Forum will be on May 28th, where we'll be focused on AI as our next topic. And there's another group called the IO Psychology Pop-Up Group. And in May, it'll begin meeting again every Thursday in the evening, US time, at night, the European time, just an informal, unrecorded session of IOs who like to talk about whatever's going on. These are the officially shared events that I have. Do our panelists have anything else that they'd like to share, whether just commenting or putting it in the chat before we wrap this up?
The EU OHP conference is coming up in Helsinki in June.
I haven't got well, there's conferences by the King Fund. I don't know the correct date, which is kind of this external organization that really kind of influences leadership and how healthcare systems work in the UK. They have a really good conference, and I'll post that in. But I think for me, one of the best things that I have that I think people should start considering, especially going into organizational psychology or organization development, is start broadening your lens in terms of how you view organizations and your wider reading. So start looking at less traditional kind of things. So instead of just focusing on models that are taught to us, look at things around like complexity theory and things like that, and how shame and things like that work with individuals and teams, but show themselves up in organizations, because that then helps shape how you are as a practitioner in your organization and in the healthcare setting. And I'd be happy to kind of pop some books and resources in there for people.
Awesome. Then, thank you once again to all of our panelists for being here and speaking for the hour about your experiences. Also, proper shout out to Rigo as well, who's been helping me host these events and also runs all the tech side. I am able to engage and listen to answers and learn, because guess what? I'm horrible at multitasking, but I know Rigo, so it's all okay because he does the hard stuff while I get to actually be part of a fun conversation. And also, thank you to our attendees who are here to learn and to grow. And we would not be hosting these if there was not an audience of people who are interested in the first place. So thank you for sure going out and learning more about IO, but also having the ambition and the gumption to show up to extra events like this and to really be trying to set yourself up for success. So once again, just for everyone, thank you for this. Go ahead and open any links or click whatever you need in the chat, because we are about to close the room. And thank you to our panelists for also staying that extra 60 seconds to make sure that we're getting to answer whatever questions have happened. I guess my last recommendation before we go and we officially close the session is going to be quick. Take a screenshot, go find as many people as you can on LinkedIn. That's how a good number of people find these events in the first place. That's how a lot of our PR happens. And guess what? Each of these panelists also has a LinkedIn. They might even be willing to connect with you if you're really nice.
Thanks very much, everyone.
All right. Thank you
Thank
again to our
y'all.
panelists. I look forward to next month. See everyone.
Thank you.